For you coming up next.
Organization or community group is interested in referring candidates for job openings, please contact us by visiting WJLA.com.
At Tropical Smoothie Cafe, all of our smoothies and food start with fresh ingredients, craveable combinations, and bold flavors. Made just the way you like. Any time of the day. Only at Tropical Smoothie Cafe. Eat better, feel better. Craving Tropical Smoothie Cafe? We deliver. Look for us on your favorite delivery app.
I'm Alfonso, and there's more to me than HIV. There's my career, my cause, my choir. I'm a work in progress. So much goes into who I am. HIV medicine is one part of it.
Prescription Dovato is for adults who are starting HIV-1 treatment and who aren't resistant to either of the medicines dolutegravir or lamivudine. Dovato has 2 medicines in 1 pill to help you reach and then stay undetectable, so your HIV can be controlled with fewer medicines while taking Dovato. You can take Dovato any time of day, with food or without. Don't take Dovato if you're allergic to any of its ingredients or if you take the phthalide. If you have hepatitis B, it can change during treatment with Dovato and become harder to treat. Your hepatitis B may get worse or become life-threatening if you stop taking Dovato. So do not stop Dovato without talking to your doctor. Serious side effects can occur, including allergic reactions, liver problems, and liver failure. Life-threatening side effects include lactic acid buildup and severe liver problems. If you have a rash and other symptoms of an allergic reaction, stop taking Dovato and get medical help right away. Tell your doctor if you have kidney or liver problems, including hepatitis B or C. One of the ingredients in Dovato may harm your unborn baby. Your doctor may prescribe a different medicine than Dovato. Your doctor should do a pregnancy test before starting Dovato. Use effective birth control while taking Dovato. The most common side effects are headache, diarrhea, nausea, trouble sleeping, and tiredness.
So much goes into who I am and hope to be. Ask your doctor if starting HIV treatment with Dovato is right for you.
Washington tomorrow.
It is the sound of another win against COVID-19, a patient leaving the ICU at a Madrid hospital after being cleared. In Spain, more than 43,000 people have now recovered from coronavirus, a welcome sign that the world will soon be on the other side of the curve. Well, now the new details on the tiger that tested positive for coronavirus at the Bronx Zoo. And ever since that big cat started showing signs, now other big cats are showing signs. So how does this affect your pets at home? ABC's Will Reeve has the story.
Officials at the Bronx Zoo, home to the first animal in the United States to test positive for COVID-19, say they still aren't certain who infected a tiger there.
We're assuming one of our staff had the infection and were spreading, the virus unknowingly.
The 4-year-old Malayan tiger named Nadia was born at the zoo in 2016, making her public debut alongside her sister Azul. Now 7 big cats in total, including Azul and 2 more tigers and 3 lions, are sick.
All of the tigers and lions that got sick had a cough, and it was a dry cough, not a productive cough. There's no treatment that is known to work. So we've treated just symptomatically.
The zoo also taking extra precautions for the staff who interact with the sick animals.
Wearing coveralls to prevent transmission anywhere, gloves, regular masks, and goggles or face shields.
All of the big cats are expected to make a full recovery, but the concerning revelation that animals can be infected has many worried about their pets at home. There have been reports of several cats and dogs testing positive for coronavirus overseas, but according to the CDC, no pets in the United States have been sickened, and there is currently no evidence that pets can pass coronavirus back to their owners.
Well, so many pet owners still have concerns about their animals possibly getting infected or even their animals getting sick or their owners getting sick. Well, Dr. Jen Ashton with more on what health experts know about animal transmission so far.
The CDC and the American Veterinary Medical Association really suggest that if a human is sick and it's implied or assumed that they have COVID-19, that they keep their distance from their pets just as they would other people. We know that the virus can survive on hard surfaces. It's not known if it can live on fur. Obviously, you can't use a bleach wipe on your pet. But that's why, maybe wiping them off with water once in a while, if that's possible for dogs, not cats as much, but really treating them as you would another person and keeping your distance if you don't feel well. Asymptomatic spread, we don't know what we can do about that to protect the pets.
All right, well, check out this adorable video as our furry friends get up close and personal with all of the cool animals at the Georgia Aquarium. A few weeks ago, pups got the chance to roam free around the aquarium. Now it is Nemo, Dory, Guppy, Marlin, and Bubbles' turn. The Humane Society says the kittens stared in awe at the fish, but they love the jellyfish.